Male pattern baldness affecting millions of men worldwide. Let's dive into the latest information about this common type of the hair loss. Male pattern baldness is characterized by progressive, gradual hair loss that could take years. It usually starts with thinning of the temple hair and the crown hair, and it could progress into distinctive horseshoe pattern of the hair loss. Let's talk about statistics. By age of 35, 66% of men will have some type of noticeable hair loss. Around 85% of men will have some significant hair loss by the age of 50. Surprisingly, approximately 25% of men start losing hair even before age of 21. So what are the causes and risk factors? The primary causes of the hair loss are genetics. It is reported that multiple genes are involved in explaining why some people are more affected than others. Hormones, particularly androgens, can lead to increased DHT levels, and in sensitive individuals lead to more progressive hair loss. In 2023, most recent study indicated that 5 genes were proven to be associated with male pattern baldness. One of the genes, called AR, located on X chromosome, have been consistently linked with the hair loss. There are multiple treatment options available. FDA-approved options such as minoxidil and finasteride are backed by tons of research and been proven to help in prevention and treatment of early hair loss. There are many emerging treatments such as stem cell, progenitor cells, topical finasteride, fractional laser such as follicles, and many others that we can discuss during your consultation. A new study report from 2024 showed that a naturally occurring sugar, a 2-deoxy-D-ribose, can help to treat some of the hair loss by promoting angiogenesis or formation of new blood vessels. It is important to remember, male pattern baldness could be a natural aging process for some men. However, for some of us, it could be devastating as it affects our self-confidence and image. Hair loss is not a health concern by itself, but if you're emotionally affected by your hair loss, we're here to help. As research continues, there's more data and information about hair loss become available. In the future, we'll have more options to treat male pattern baldness. So with any questions about hair loss and how to treat it, please don't hesitate to contact your healthcare provider with experience in treatment such conditions.